Hi, my name is Caitlin Horn, and today we'll be talking about how to use extracorporeal shockwave therapy in the horse and dog. We have no conflicts of interest to disclose, and the animals used in this presentation were done so with owner consent. What is shockwave therapy? It is a non-invasive modality that uses high-energy acoustic pressure waves that are created outside of the body that then deliver mechanical energy to tissues in the body to stimulate healing. Shockwave therapy was first used in the early 1980s as a non-invasive treatment to eliminate kidney stones via lithotripsy. By the 1990s and early 2000s, researchers began to explore therapeutic ways to use shockwaves. Shockwaves are characterized by a rapid rise in pressure followed by a rapid decline in pressure. The positive rise generates direct mechanical forces on the tissues, where the rapid decrease in pressure causes indirect mechanical forces via cavitation bubbles. A theory on the mechanism of action is that treated cells undergo microtrauma, which stimulates the cells to release anti-inflammatory cytokines and growth factors into the treated tissues. This can help stimulate the removal of damaged tissue while stimulating different healing mechanisms such as angiogenesis and osteogenesis. There is also an analgesic property to shockwave therapy. The mechanism of how is not well understood. Has been shown to provide pain relief for at least 48 hours. It is important to be aware that there are different types of shockwave machines with different properties, which may affect how and what you choose to treat with the different machines. There are four main categories based on how the shockwave is created. This includes electrohydraulic, electromagnetic, piezoelectric, and radial or ballistic. All use focused energy except for radial. Therefore, radial is not discussed as a true shockwave, but rather a pressure wave. Focused shockwave machines direct the energy into the body at a selected depth based on the injury or tissue being treated, versus radial pressure waves, which are unfocused energy, dissipate as they travel, as depicted in the picture, making them best for more superficial structures. We will discuss electrohydraulic and piezoelectric units more specifically as they are common machines utilized in veterinary medicine. Starting with the electrohydraulic machine, these shockwaves are created using a high voltage spark gap that creates a high peak pressure with a large focal volume, whereas the piezoelectric unit uses crystals in the handpiece to create a shockwave, which then has a more narrow focal volume. This is important to consider during treatments, as a piezoelectric unit will require more consideration to direct the energy as close to the targeted treatment area as possible. Electrohydraulic units have traditionally been thought to have the greatest depth penetration of up to 110 millimeters. However, some piezoelectric machines are now claiming increased depths up to 200 millimeters. However, still with a more focused energy, which should be taken into consideration. Due to the differences in these machines, patient tolerance can be different between units. Historically, the electrohydraulic units are louder and can potentially be more painful when administering the treatment, making sedation needed sometimes in the horse, but for most canine patients, whereas the piezoelectric machines are typically quieter and potentially less painful during treatment, and therefore better tolerated by the unsedated patient, most appreciated in the small animal cases. The settings that are usually altered per treatment include the depth of treatment, energy per pulse, and the number of pulses applied. The depth of the treatment should be selected based on the location of the injury or tissue being treated. Then the amount of energy applied per pulse is selected, which is described as the energy flux density. It is expressed as millijoules per 1 square millimeter. Then the number of pulses that will be applied. Therefore, the total energy applied to the tissue is the number of pulses times the energy per pulse. It is important to note that the highest energy deposition and greatest biologic effects are seen at anatomic regions of differing tissue types, such as bone and soft tissue interfaces. This is what makes this modality so useful at areas of enthesopathy, such as the origin of the proximal suspensory ligament in the horse. Now we can discuss how shockwave therapy is used in clinical practice. When treating musculoskeletal injuries, shockwave therapy is commonly used for tendon and ligament injuries, especially at tendon or ligament interfaces with bone. osteoarthritis, bone healing, thoracolumbar pain, as well as for wound healing. It is important to understand potential complications. Side effects of this therapy are typically short-lived, but should be discussed with owners before treatment. Most commonly seen in small animal patients is petechiation or bruising of the skin, whereas in the equine patients, it is more common to see local swelling in the treated area. Microfractures of osteostructures have been proposed, as well as damage to normal tendon or treated tissues, with excessive dosage, making following recommended guidelines important. Contraindications exist for shockwave therapy. Sites containing neoplasia should be avoided due to potentially displacing neoplastic cells and resulting in spread of these cells. Bone physes should be avoided due to causing premature closure, resulting in retarded bone growth. Cases with bleeding disorder should also be avoided due to concerns for hemorrhage. Traditionally, contraindications included gas-filled structures such as the intestine and lung due to the acoustic impedance of air reflecting all of the energy and therefore potentially causing tissue damage. However, there is recent work in horses looking at shockwave therapy as a treatment for exercise-induced pulmonary hemorrhage and now asthma, and is showing possible benefits. During treatments, awareness and avoidance of large nerves and vessels is recommended. Vessels can sustain damage causing rupture, vasoconstriction, or increased permeability, while in nerves, the cavitation mechanisms can cause repetitive action potentials. Now, how to perform shockwave therapy in clinical cases. First, pick the correct trode or gel pad that is appropriate for the depth of penetration you need for the injury or tissue you are treating. Then select the settings on the machine. This typically includes the level of energy, the frequency or speed of delivery of the pulses, and lastly, the number of pulses to be applied. The selected setting should be related to the injury size and tissue type that you are treating. Typically, there are recommended guidelines tailored to each machine and should be ideally followed to avoid overdosing and potentially causing tissue damage. You should then prepare the patient or treatment area. To provide adequate contact, the area should be cleaned and gel should be applied. The hair does not necessarily need to be clipped if appropriate contact can be made. Gel can be applied to the standoff or trode head to allow proper transmission of the acoustic energy and can be reapplied throughout the exam as needed. Like ultrasound waves, shock waves do not travel through air. Due to the noise and possible associated pain, positive encouragement or treats can be used to assist in making this a positive experience if your patient is not sedated. A slow, small scanning technique can be used to deliver treatment throughout the joint or soft tissue injury, but allowing focused treatment of the affected tissues. This is an example of electrohydraulic unit that can be more stimulating for patients both in noise and pain from the treatment, and ear protection may be considered. Post-treatment considerations include possible local irritation and pain, which may be visualized as local swelling. Due to the proposed mechanisms of action, the use of anti-inflammatory medications and cryotherapy around the treatment times should be avoided. Due to the potent analgesic effects seen with shockwave therapy, most noted within the first 48 hours, giving 2 days off of exercise is recommended to prevent any further damage to the tissues during this time. Of note, this analgesic effect is what makes shockwave therapy regulated or banned from competition and should be discussed with owners. This was a quick review of shockwave therapy and how to use it in both equine and canine patients. This is a list of our references for this presentation.